What are the 3 best exercises for low back pain? So, there are none. It's unfortunate, but we live in a world where we want to know exactly what to do. We have a problem, we need the exact solution, and we really like things to just make sense like that. A plus B equals C. My back hurts, I need to move it, what should I do? Back pain is very multifactorial. It is extremely complex, and anyone that gives you a quick fix is trying to help you, probably, but they're doing you a disservice because this like fix it mentality for our bodies isn't helpful because it's not most people that doesn't work, whatever the fix is, and then they get frustrated and they think they're effed, and it just leads to this like whole spiral of complexity and pain and frustration and trying different practitioners. And well, this person said it's my QL, and this person said it's my hip flexor, and this person said my pelvis was out, and this person said my foot doesn't move. Like, what is it? And it's like, I deal with this every day in practice. You could see 10 different practitioners and get 10 different explanations for your back pain. No one's asking you about your lifestyle, your programming, your sleep, your diet, your thoughts and beliefs about your back, and what have you. They're just, assessing your body and finding what's tight and telling you that's the cause and fixing it, but then it comes back and it's just like so frustrating. And I validate that for people because I get that. But as a chiropractor who has studied musculoskeletal health for a decade and studied the spine and know back pain very well, I will say you can recover, but it won't be from a specific exercise and it won't be from someone doing something to you. So passive care is considered as a treatment being done to your body. So like needling, an adjustment, massage, ultrasound, laser. These are called passive care, passive modalities, and they don't do anything to improve your tissue capacity and your ability to tolerate loads and tolerate life. And most people like that. They like it. They like getting a massage. They like getting adjustment. They love getting dry needling. It feels good in the moment, but it doesn't fix the problem, and then you kind of keep having to go back. For those people that it fixed them, like, that's awesome. That's not really who we're talking about. We're talking about people it doesn't fix, which is most people that are in my office because they've already seen a bunch of people and other chiros and other physios, other massage therapists, and they still have their pain. So what I will say is, don't think of the body like a car with parts that just need fixing. And as soon as that part is fixed, we're good now until we put a bit more mileage on it and then we need to fix again. You need to think of the body and the nervous system like more like it's biology. It's everything is interacting with each other, and the internal environment is dependent on the next system. So I like to think of it more like a garden. So your body is more like a garden, and it needs all the things. It needs the sunlight, it needs the nutrients, it needs the companion plants, it needs water, and not too much of all of that stuff, but not too little. And it's just like this sort of process where you're always trying to figure out how to make the plant thrive. That's the exact same with the human body. So when someone comes to me with low back pain, I am trying to give them movement, but it's not because I think it's going to fix their pain or fix their back, because the research is really leaning towards like there's no best exercise for low back pain, but we do want to keep people active and keep people moving. So we have to figure that out with the person. So really, I want people to take a more global approach. Look at your life and think of all the ways you could be healthier. Just in general, like, could you clean up your diet and have a more anti-inflammatory diet? Because inflammation is huge for pain and our energy levels and just our brain and our nervous system and sleep and all that. So food is a really, really big one in terms of back pain. Just having more whole unprocessed foods, things that, all the things, what you should and shouldn't eat. But it makes a difference with pain, as well as your sleep. So if you're not sleeping well, your nervous system is going to be wound up and you're not recovering from your day before, and definitely pain can be worse. So I work a lot on sleep hygiene with people. That could be an entire other hour-long video, but I won't talk about that. But if you can improve your sleep, go for it. That's going to really help your back. 2, just moving more throughout your day, spending less time in sedentary positions. If you have to sit for work, you need to go for a walk on your lunch. You need to get up every half an hour and walk around a little bit. Stand for phone calls. Get a standing desk. Kneel at your desk. Just get in variable positions throughout your day. So limit sedentary time, and then shoot just for more steps in the day. Like if you can tolerate little bits at a time, then do little bits at a time. Then we'll talk about training. If you're someone who works out, we would get you on a program that works for you, that isn't too much and it's not flaring your back up. And we're doing resistance training and we're doing cardiovascular training. So that still has to happen with back pain. But for sure, there's things like you could do way too much in the gym and flare your back up, and you could do not enough and you're going to get no training effect. So there's definitely a sweet spot with training, which takes a bit of an art and science to figuring that out with someone who knows that, as well as getting your cardiovascular system working, getting your 150 minutes a week of cardiovascular exercise. Like, are you even getting that? Are you biking? Are you walking? Can you row? Are you jogging? Like swimming, hiking? Those are things that we need in the program just for health and longevity. And that's going to help back pain as well, indirectly. The next thing I'll talk about are thoughts and beliefs. So we know this is very, very well documented. Your thoughts and beliefs affect what we feel. Like, think about it. Have you ever been home alone and it's dark and you're scared and you hear a noise and you jump, but it was just like snow falling, and that's what I'm looking at right now, or like something in the basement creak and you're just freaked out. Like, your thoughts and anxiety are like making your nervous system like ramped up. If that example doesn't land, I will give a more intimate one. If you've ever like thought about something, or closed your eyes and pictured something, or just like thought about something that turned you on and made you feel something in a different part of your body, that's thoughts and beliefs. That is our thinking affecting our physiology, getting turned on, like whatever, based on seeing something, like you just saw something and you got turned on. Like, that is the best example I can give of how your thoughts and beliefs affect what you feel and affect your physiology, and it 100% applies to low back pain. So if you think your back is effed and you should definitely not sit or bend or lift, it's going to make you very sensitive to those things. If you think every time you feel pain, something's damaged or something's wrong in there, it's going to affect the sensitivity of your back. And so these are things that I would work through in assessment with you, is like figuring out your thoughts and beliefs, learning what you've been told by other practitioners, learning what your parents taught you. Like, there's so many things that go into your culture, like so many things that go into our thoughts and beliefs about pain and our bodies. And then we might have to unpack some of those. Like, I might have to show you it's safe to bend and get you bending in a way that actually doesn't hurt, and then just retraining those thoughts and beliefs. If you think running is bad for your back because it's compression, well, no, runners have better back health than those who don't run, and that's well researched. Like, these are things that we need to kind of unpack with people so they can start understanding that not every hurt equals harm. It's okay to move through some discomfort. That's kind of normal. And then, just sort of tackle those things. The other thing is preparing your body for the tasks you're trying to do. If you want to play hockey and you haven't played hockey since last year and you haven't trained for hockey in any capacity, and then you went and played hockey and your back hurt, well, like, no one is surprised that that hurts. Like, why would it not? Like, you're not ready for the task. It's like high impact, it's different muscles, it's different positions, it's that like hinge and push off and skating, and like just all of these things that you have to prepare your body for. Same thing with lifting in the gym. Like, if you ramp your weights up too fast, you can cause some irritation or sensitivity to the tissues because you're asking your body to do something it's not ready to do. So I think that's really important because we do a lot of boom and bust, it's called, where it's like, I'm not doing anything right now and now I'm hitting it really hard. Oh, now my back hurts and why does this keep happening? Well, you need to be consistently active and consistently exposing yourself to like stressful tasks, not too much, and then adapting, and then doing a little bit more and adapting, a little bit more and adapting, and then soon, like, you can do anything you want, really, even if you have disc herniations and degenerative discs and facet arthritis and stenosis, like all of these things that MRIs and X-rays like tell us about our backs. You can still function very well with all that stuff. You have to prepare your body for the tasks you're trying to do. So that's just a little overview. Coming from a chiro, so passionate about helping you and keeping people active and healthy through their injury, because life doesn't stop, as you know, because you have back pain. You still have to go to work, you still have to take care of your family, you still have to function, and back pain is the number one cause of disability in the world. It is extremely common. It doesn't matter how much money you make, where you live, your culture, like, it is the number one cause of disability in the world. So needless to say, anyone watching this probably has had back pain. I have back pain sometimes, but I've learned how to manage it. And that's the thing. We're looking for how can you manage your pain, not how do we fix it. How do we make it go away so it never comes back? People that are trying to fix it, to be honest, are the most stuck in the cycle of chronic things and are more likely to get medical injections, surgeries, these things looking for a fix to their pain, when oftentimes there isn't a fix. Some rare cases there is, and surgery is recommended 100%. I'm not saying surgery is not recommended. But if you are in the absence of progressive neurological deficits, you're not a candidate for surgery just because you've had back pain for a long time. That's a whole other conversation. But reach out to me if you have any questions. Let me know in the comments your story, your journey. If you need some guidance, like, let me know. This is what I do every day. So thanks for watching. Have a great day. Peace.